Sometimes, in times of great stress, it can be helpful to know what you're in for. So you may get comfort from these little fun facts about baby reflux. 50% of babies under 2 months old have reflux, but that's not as much as the 60 to 70% of babies from 3 to 4 months old that have reflux. So this means that chances are, if you have a newborn, you have experienced baby reflux, which is not fun. It's hard on the family, it interrupts workflow, it's hard on sleep, and it's highly stressful. I can still think back and remember when I would take a shower and think that I'm hearing a crying baby and no one was crying. It's almost like this stress response, that you're kind of in this heightened state of stress constantly as a parent. And I get it, it's so hard. The good news is that by 12 months old, reflux typically resolves on its own, which is fantastic. But what do parents do from, that newborn time up until around 6 months when reflux is most active? Unfortunately, this is when medications are most overprescribed. And part of this comes from the kind of lack of firm diagnostic tests for baby reflux. We just don't have those. And then the other part of it is, that parents want a solution, doctors feel pressured. This has actually been documented in studies. So there is an overprescription of medication happening. There is a difference between baby reflux and reflux disease, or GERD. And this is worth understanding because it's understood that reflux is a spectrum. Basically, baby reflux disease is a situation that is a little more intense. Symptoms of normal baby reflux include regurgitation and vomiting. In silent reflux, you won't get this. Choking, coughing, hiccups, swallowing difficulties, and intense crying. Reflux disease has these symptoms, and in addition to that, there's inconsolable crying, irritability, trouble sleeping, and regurgitation patterns. Basically, it's baby reflux with the volume turned up. Really, what practitioners do is they look at symptoms and they decide for themselves, how bad it is. And this is very subjective, and this could be why medication is overprescribed. Sometimes there is pH monitoring, and this will tell you how acidic the reflux or the regurgitation is, and it can be helpful. However, if medication is being overprescribed without these tests, then sometimes baby reflux is either weakly acidic or non-acidic. And so literally nothing is being done for these conditions if you're just using an acid-reducing medication. And in fact, in 2012, there was a review done for the FDA that looked at 4 clinical trials, and they failed to find any benefit of PPIs, which are commonly prescribed medication for infant reflux. So the first reason that baby may have reflux is a loosening of the lower sphincter of the esophagus, right? So we've got this problem here where the muscles aren't tight enough, food's not moving through the way it should, and so there is regurgitation. So in Chinese medicine, we do have prokinetic herbal formulas that can help support gut motility, that can help support muscle tone, and that are known in Chinese medicine overall to support gut health. And so generally with babies, what we know is that babies tend to have immature digestion, weak digestion, and they need a little bit extra warmth and support in that area. Essentially, prokinetic herbs would support gut motility, they would move food through the esophagus, and strengthen muscle tone. And it's worth noting too that probiotics, meaning like lactobacillus and bifidobacteria, probiotics that you get in a little capsule, these have a prokinetic effect. They support gut motility. Which brings us to the next reason why reflux may be an issue for your baby, and it's kind of like low-hanging fruit. Like we really just want to address this. Your baby's microbiome and their gut health is cannot be overstated, incredibly important, especially pregnancy and, that newborn time period, the first year. Pregnancy, first year, so important. So much programming goes on during this time, and it's just critical. So we really want to make sure that your baby has all the bacteria that they need to thrive. And these are specific types of bacteria. What we really want to look for are Bifido bacteria. In general, we want babies' gut bacteria to be mostly Bifido bacteria dominant. And breast milk can help a lot with feeding these good bacteria. We want to avoid antibiotics. We want a vaginal birth. All of these factors are important. And still, even when these are present, baby can still have reflux and the baby gut can still be out of balance. A review published in 2021 looked at 6 randomized controlled trials, which are which are higher quality studies. They looked at 6 RTCs on the efficacy of probiotics for baby reflux. And all of the studies that they looked at used the probiotic Lactobacillus rhodori. Really, the only reason why all of these 6 trials used L. rhodori is because that was used beforehand. And so they just kept using the same probiotic. The researchers in this review even noted that you don't necessarily need to use this probiotic and that other species may have the same effect, which means that they also strengthen the gut barrier, fight inflammation, and enhance gut motility. If you would like to know more about which probiotics I recommend for baby gut health, I do have a free download that you can go to my website, megangarcia.com, and there should be a little pop-up box. You can download it there, or you could just sign up for my newsletter and grab it. Next is food allergy. Now, food allergy is something that a lot of parents are very aware of, and I think it's because, if you're breastfeeding or if you're formula feeding, it's pretty clear when your baby is responding to something in your breast milk or the formula, and typically this is cow's milk protein. Even though the connection between food allergy and baby reflux so far is not firmly established, academic institutions have recognized okay, there is some connection here. We get it. We see this. We acknowledge it. So because of that, there is a recommendation to, before starting medication for reflux disease, to at least remove cow's milk from the mom's diet or to switch formulas in order to see if removing cow's milk protein can resolve the issue completely. As I mentioned earlier, when considering food allergy in the context of baby reflux, it's really important to understand that there is a bidirectional relationship. And that is because not only is it that the cow's milk or allergen causes the reflux, but when the esophagus or the intestinal tract anywhere in the gut is inflamed, this kind of opens the door for food allergy. Any immune response in the body will involve specialized immune cells called mast cells, and these cells release histamine. Too much histamine is related to histamine overwhelm or histamine intolerance. Histamine overwhelm can translate into things like itchy skin, eczema, hives, runny nose, congestion, gas or tummy pain, and transit issues like constipation or diarrhea. If baby has eczema and reflux, there is a greater likelihood that we're actually looking at food allergy. Now, babies, in my experience, and there's some science here, but again, it's not fully developed yet. In my personal experience as a practitioner, babies tend to have a lower tolerance or threshold for histamine. And this has to do with their gut not being fully developed. And so they're not making adequate amounts, possibly, of the enzyme called diamine oxidase, or DAO, which helps to break down histamine because their gut is still developing. If you suspect that your baby's reflux is related to food allergy, which again is more likely if eczema is also present, then what you want to do is remove the allergen. And this is typically cow's milk, but it can also be egg, wheat, or soy. And you want to remove the allergen for 2 to 6 weeks and then go through a reintroduction period of around a week where you gradually increase the amount to 1 serving size. And if this is through your breast milk, then you're eating a full serving of cow's milk, which would be like a cup of cow's milk or an egg. In my personal experience, if you are breastfeeding and you haven't started solids yet, I would get the allergen into your diet first, make sure it's well tolerated, and then add it to baby's diet. And in terms of milk, for example, you want to start with baked milk. And I do go into this in my first foods class. I talk about baked milk and baked egg. These are 2 allergens that are better tolerated when they're baked. So we would start there and work in very small amounts and incrementally build up to help educate baby's immune system and build oral tolerance. I hope this is helpful. These are 3 ways that you can support your baby's gut and immune development when infant reflux is present. The last 2, the probiotics and the allergen removal, those are things that you can kind of address on your own. When it comes to Chinese medicine and herbs, you generally want to work with a practitioner. So start with the low-hanging fruit, start with the probiotics, make sure gut health is on track, assess with a practitioner possibly whether or not food allergy is present. If eczema is part of the picture, I would definitely work with Chinese medicine. And if it's not, you could still, depending on where things are at, you can still add in Chinese herbs to kind of help baby's digestion and use those prokinetics to improve gut motility. Here's to better baby health and raising resilient kids. Until next time.